Good afternoon, I'm Dr. Discogenic. We are live streaming live spine surgery from Duke Spine Institute here in Melbourne, Florida. Our patient is a Floridian lady. She has a herniated disc at C6-C7. She has pain in her neck. It radiates into her shoulder on the right side and intermittent radicular symptoms in the arm. Her herniated disc is causing neck pain, and the inflammation that is going on in the back of that disc associated with the herniation and annular tear is causing her cervical brachial pain. She wants it fixed. So we're going to go in at C6-7 and do the Duke laser disc repair. Our approach is from the left side of the neck. Her symptoms are on the right. We always go opposite of the patient's symptoms. Worst symptoms, I should say. First thing I'm going to do is palpate the spine right in the middle. By doing this, I'm pushing the trachea and esophagus medial, the carotid sheath and its contents lateral. 2, 3, 4, 5, 6, 7. I'm a little higher than I should be. I'll come down a little bit. I do that by moving my fingers. There's a little groove here I'm working in. Shot. You can see there's a bit of a collapse of the disc anterior. 2, 3, 4, 5, 6, 7. Let me go a little bit lower. I want to line up directly in front of the disc. All right, shot. I've just got an AP. I've got a tiny window here to work through. There's only maybe 5 people in the world that know how to do this type of surgery. You can see I'm displacing the trachea and esophagus. Jordan will show you the endotracheal tube and esophageal temperature probe. Shot. Shot. AP. Quick AP. All right, you're going to look and see that there's 2 lines here to the right of my fingers, and that is the endotracheal tube and esophageal temperature probe. See that? All right, lateral. You see the tip of the needle is directly in the midline, right over the spinous process. That's where we want to be. This is endoscopic spine surgery, true endoscopic spine surgery, not like the fake stuff they try to sell you into having at other locations. Our procedure is true uniportal endoscopic spine surgery. All right. If you have questions, feel free to type them up. In the meantime, we're going to get into this disc. Shot. Can you give me a little inline traction? Shot. Actually, we're getting in there, but just a slight inline traction. Slight. And shot. Shot. There we go. Shot. Perfect. All right, we're in. Now, Jordan, do the count. We're good. Do the count for us, please. I want to count from C2 down. One of the biggest concerns in spine surgery is what's called wrong level surgery, and that's when the surgeon operates at the wrong disc. So we always want to keep checking over every move we make to make sure we're at the right place. Go ahead. 2, 3, 4, 5, 6, 7. So we are at C6-7. You agree? Which lever are we supposed to be operating on? 6-7. So I'm just verifying that we're at the right place. I'm going to do a discogram. I'm injecting some substance into the disc. Look at the tear. Holy henna. Look at the size of the tear. All right, there's the tear. Now, Jordan, show us where the tear starts. Right there. You guys see that? That's the beginning of the annulus. That whole thing from there to there, left to right, is a giant tear in the annulus. And you can see it's at the bottom part of the disc. That's where her herniation is. We're going to go in there and clean it out. So to do that, I'm going to place a guide wire through the needle, and I'm going to use the X-ray machine to guide me. Shot. You can see the defect is pretty substantial. The guide wire went right through. I'm going to put some numbing medicine, and then we're going to make a 4 millimeter skin incision. Any questions, feel free to type it up. In the meantime, let's talk about what causes neck pain. At Duke Spine Institute, we have discovered There are 30 specific causes of neck pain, just as there are 30 causes of back pain. Now let's show the audience those 30 causes of neck pain. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. All right, welcome back. You can see from our video that there are 30 different things that cause neck pain. This patient has just one, and it's the herniated disc at C6-7. We're going to go fix that for her. We're doing what's called transdiscal endoscopic surgery. I've used AP and lateral x-rays to not just localize the level that I have to fix, but to navigate. All right, Dr. B, my anesthesiologist. Since our patient's completely asleep, I need your help with a little bit of inline traction to open up the disc space so I can get in there easier. Perfect. Perfect. Just keep it there. Shot. All right, here we go. So I'm going to try to advance with my fingers by twisting and pushing a little bit just to get in. And there you go. I got in about 2 millimeters, 3 millimeters shot. All right, now that I'm in through the anterior ligament, I'm going to use a mallet to drive this thing, the tip of the dilator, all the way to the back of the disc so we can fix the herniation. Any questions?
At this moment, no current questions.
Henry, could you share with the audience our video on why do herniated discs like this one cause so much symptoms for patients? The answer may surprise you, folks. It has nothing to do with pressure on a nerve. It has everything to do with inflammation. Everything okay, B?
Yes.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963. Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back, Sean. Our patient, at this point, I'm trying to advance the tube that I'm going to do the surgery through over the dilator. And the dilator is giving me a bit of a difficulty. It keeps moving forward with the tube, which we can't have that. Sean, you don't want the dilator to go into the spinal cord. That would be really bad. Okay, Sean. So I'm having to make these adjustments, which I don't normally have to do. Sean, see that, how the two of them are moving together? Now the tube is moving, dilator's staying still. All right, that should be about right there, should be perfect. That's really good position. Show us the tip of the tube there, Jordan. Guys, see the tip of the tube? It is at the back of the disc.
Yes, we do.
It's right where the herniation is, right where the annular tear is that's causing all of her symptoms. So we're going to clean this out with a laser. It'll take me 15 minutes to do, and then we'll be done, and she's going to go home in an hour. This is outpatient spine surgery. There is no fusion involved, no metal, no bone graft, no cadaver bone, no fibular strut graft or fibular graft, nothing. It is the most pure, beautiful spine surgery you can have done, all natural. We're letting her body do the healing, but we're just helping it. All right, irrigation's on. I need irrigation. Thank you. All right, if you have questions, type them up. So we've shown the audience the 30 causes of neck pain.
Correct.
And we've shown them how, guys, this is too dark. What's happening here? Am I, wrong one. All right, can you make it brighter? Am I missing anything? Can you put the irrigation here? Or the towel?
Yes, sir.
I don't think that's it, Jordan. Bottom's at 100?
Yes, sir.
Interesting. Maybe this light cable needs to be replaced.
Doesn't look like it's all the way in, Dave. Is it all the way in? Try it again. Now lock it in.
That's a little better, but still not phenomenal. But that's good. That's good enough. Oh yeah, we can see. All right, take a look. When I first went in there, you guys could see a bunch of red. That was some inflammatory tissue. These are all pieces of herniation coming out. The laser fiber is at 12 o'clock. That is a 0.45 millimeter or 450 micrometer diameter fiber. It is a fiber optic fiber. Its job is to transmit electromagnetic radiation, which is what laser energy is, from the laser machine down here to the herniation. So I can direct the laser on the herniation and use the laser to clean up the herniation. This is right here is the herniation that I'm zapping away. It's a big one. I'm going to go side to side, foramen to foramen. Any questions?
At this moment, no current questions.
All right. That's a big herniation right there, folks. It is not going to come out of this tube in one piece. The tube is internal diameter around 2.9 millimeters, just under 3 millimeters. That's very small. The actual incision is 4 millimeters in the skin, 4 millimeter skin incision. Do we show the audience how these herniations cause so much symptoms?
Yes, we did. Of course.
All right, good. Thanks, Henry.
Not a problem.
All right, I'm going to swing over to the other side. Thank you, Luis. keep this tube under control. All right, what are we looking at? This is the back of the disc. You can see the end plates of the vertebral body, C6-C7. Those are the end plates there. There's a piece of herniation right here. The whole back of this disc has herniation. All right. Look at that thing. It's huge. I'm going to have to chop it into pieces. There's a bone spur right there I'm getting rid of.
We can see.
Yeah. There. Ooh, look at that. Look at that thing. It just came out. Right there. You see that?
Yes, we do.
That's amazing. That's not the only herniation, that's part of it. So there's more to come, but that's a good chunk. It's probably 2.5 millimeters, 3 millimeters wide. I'm going to go grab it and fish it out. There it is. So right there, you guys see that right there?
Yes, we do.
I don't know if you can see it, but it's a hard piece of herniation. It is not the whole herniation, it's just part of it. And you can see it is about 3 millimeters wide, 3 millimeters long, and about 2.5 millimeters. So when we talk about a herniated disc in the neck or back, it's never, ever, ever one herniation. It's always a conglomerate or collection of many herniations. And that, the typical number based on my many years of doing this is around 30 pieces per disc of various sizes. Okay, very important to keep in mind, various sizes, not one size. They're not all equal size. Some pieces are bigger, some pieces are smaller. Any questions?
At this moment, no current questions.
All right, Henry, talk to me. What videos have we shown our audience?
We have shown the 30 causes of neck pain. We have shown how it is herniated disc can cause neck pain and how it is that we cure it. We can now try to see if we can talk about the second most common cause of neck pain, which is the facets.
All right, I'm all for that.
Right.
Go ahead, play that video.
Not a problem.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, great. So we just showed our audience about facet pain, right?
Correct.
All right, good. Well, I've got a piece of herniation in the tube right now I'm working on. There you go. I just put the grabber down to grab it out, and I couldn't even pull it all out. I'm going to try again because it's very hard to get with just the laser. The way the system works is we use the laser to, okay, so the herniations of nucleus material, they don't come out easy, okay? Oh, there it is. There's the
see
Big
it.
Daddy right there.
We see it.
Wow, look at that. That is a monster herniation. That's the big one. Whole centimeter. That's huge, folks.
Wow.
That just came out of a tube that's less than 3 millimeters. So that's huge. That's the one. But there's going to be a few more pieces, so we're going to go back in. We're not going to just pretend that there's nothing more. We're going to verify. We're going to look and see. What I was trying to say is the way the system here works is really quite special. The laser, so to understand why you need both the laser and the grabber, when you get a herniated disc, what happens is the nuclear material gets stuck in the annulus. It elicits a massive inflammatory response. Your body's inflammatory system just goes crazy, right? It starts to attack this piece of herniation. And your body is trying to get rid of it. Like it's trying to literally chew it up enzymatically using enzymes. And I'm going to have to grab that piece out. And so the enzymes are being released from cells called neutrophils. And these neutrophils are coming there because your body's telling it, we got a problem over there in the back of that disc. We need you to go fight. So your neutrophils are your military. Basically, they are the infantry and the artillery. And they go in there and they just start blowing everything up, right? Trying to get rid of the herniation. Well, then after you send your neutrophils in, what happens is your body starts to the healing process, right, where it's creating scar tissue. So fibroblasts come in and make scar tissue. And these pieces of herniation, what happens is they end up getting scarred down to the surrounding tissues like the annulus. And that scar tissue, your grabbers cannot overcome the scar tissue. Your grabbers cannot grab the herniation out from the scar tissue. It's stuck too hard. So the laser is your best tool to release my God, the lighting is just not good. Okay, I'm not happy with this. I don't know what else to do. We've got to check the box. Is that the same box we used?
Yeah. I need to check the lights.
Yeah. So this right here is a perfect example of a piece of herniation that's scarred down. Thank you, Jordan. That is scarred down to the surrounding tissues, whether it's the bone, the ligament, or the annulus. I got 3 minutes left. 3 minutes. I think this is the last piece right here. Okay? And the laser is your most effective surgical tool. It's the most precise and the most effective tool at releasing the herniation off from the scar tissue, tethering them down, holding them down so you can't get them out. All right? Any luck, Jordan? Nothing? Uh-huh. I'm right now floating out pieces of herniation from the bottom where they are. All right.
Couple minutes left.
A minute or two. I've just got I'm pretty happy. I'm out on the foramen now. And you can see all the inflammatory tissue here. But you can also see the spinal cord there. Yeah, there, right there is the nerve and spinal cord. That's where the herniation was. It's gone. So I'm happy. Look at all the inflammation, all the redness, right? So I'm not going to get all this out of here because that's where the herniation was, and that's herniation was causing the inflammation. So now we got rid of the herniation, and we should get rid of the inflammation over time. Really?
Yeah, better there.
That's odd. Any questions, Henry?
At this moment, no current questions. I guess everybody asked their questions on the last stream.
All right.
Yeah, we have a good viewership and everything, so.
So this patient, we're done. It was just one disc we needed to fix. But you guys could see the massive herniation, and you can see the inflammation. You could see the scar tissue. You can see the multiple small pieces of herniation. But it was mostly one giant herniation. And you could see the red inflammation that the herniation was causing. So now we're done. We're going to take the tube out. She's going to go home in an hour. She is a very healthy young lady, ready to get back to life. And this surgery should fix her problem. She does not want fusion. She does not want anterior cervical discectomy and fusion. This surgery you just watched, the endoscopic Duke laser disc repair, is the future of all cervical spine surgery for disc problems. Unfortunately, we can't get other surgeons to do it because of insurance coverage is really the biggest issue. And they make too much money doing fusion, so getting them to change their behavior is going to be difficult. They have to be trained. It'll take a year of training. Any questions?
At this moment, no current
Let's
questions.
show the incision. So let's show the herniation too. Guys, take a look at this incision right there. Okay, the incision is literally 4 millimeters. Okay, 4 millimeters. You guys see that? And bring
Yes,
the
we do.
herniation here. Bring the herniation. All right, just take it off the white thing. Use the grabber. Guys, can you guys see the incision?
Yes, we
And
can.
look at the herniation. Give me pickups. Okay, this is so cool. Blot. We lost 1 drop of blood the whole surgery. Blot. No more. Blot it, clean it up. Check it out. How cool is this picture right here? Henry, this is the picture of all pictures.
Yes, it is. I will save it and screenshot it. Not an issue. This is perfect.
Thank you. Good job, Luis. Good job, everybody. We're going to put a Band-Aid and she's going to go home. No fusion, no metal, no cages, no bone graft, no cadaver bone, no biologics, nothing. Just pure amazingness. Let's show a testimonial
Of course.
and we'll end the stream.
Copy that.
And good morning, I'm Dr. Duke Majan at the Duke Spine Institute. I'm here with my patient who traveled to Duke Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then.
Yeah.
Why did you decide to come to Duke Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck and it was really bad. I would turn my head anyway and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Duke laser disc repair and the Duke plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.